I'm going to speak to you about a little bit of introduction, basic introduction of laser physics. Looking at CO2, we used in the past KTP, and now there's diode lasers. First, we had CO2 as one of the earliest lasers, then there was KTP, and then diode. Diode is a newer type of laser, and we'll discuss a little bit about that as well. And we'll cover the technique to be concerned with and risk prevention when using lasers, okay? But it's important to understand the very basics of the laser physics to understand how these different lasers interact with the tissue. So, if you look at the CO2 laser, and one of the big advantages of using a CO2 laser is that it's highly absorbed in the water, and also very much so absorbed in the hydroxyapatite. So the bone, primary composition of the bone is the hydroxyapatite. So because it's highly absorbed, it will very precisely and surface cut, gently cut. And also, because of its absorption in the water, it won't penetrate deeply. So the higher the level of absorption in a structure, it limits its penetration, which implies safety and control over the vaporization. So because the vestibule is water, CO2 will not penetrate deeply into the vestibule easily. So CO2 is a very, very good laser for stapedotomy for these two reasons, because of these absorptions. CO2 is used, here it's being used commercially. It cuts through acrylics and plastics, very, very through and through. However, when it goes to glass, it only gently penetrates and etches the glass. And this is important because carrier mechanisms for handheld lasers are typically fashioned out of medical grade silica. Now, medical grade silica is therefore not effective to transmit CO2 energy because it does not go through it. Right? So we have a bit of a dilemma here. If we would like to use a laser frequency that will easily penetrate through the silica, it also tends to penetrate through the water. And this is the risk-benefit of the CO2 versus non-CO2 lasers. Now, the current available delivery systems for CO2 laser are either a micromanipulator mounted to the microscope or a handheld waveguide. Now, the micromanipulator, it goes through the air. So the CO2 energy is very easily going through the air. So this is also a risk because you can just shoot the laser through the air very easily and far. So, for example, you also must align, and it's invisible, CO2. It's not in the visible spectrum. So you have to align some kind of a marker, or the red dot. And you see that with your CO2 lasers. And you have to make sure your alignment is accurate, because when you're doing a stapedotomy, you're only microns away from the facial nerve. So you have to have accurate alignment. Okay, so that's one disadvantage of the airborne micromanipulator system. One advantage also of the CO2, because it is highly absorbed in the silica, is that you can wear just any regular glasses typically. So you can have clear glasses when working. When you're using other frequencies that are within the visible spectrum, which includes KTP and the newer diode lasers, you have to have a colored glasses to block that frequency of light. So you have some problem with the visualization. So it obstructs your view somewhat because of the shading effect. Now, the handheld waveguides do exist for CO2, and they are basically a silica tube with a coating, with a silver coating. It's very similar to the technology that's used in the stealth fighter jets. So it basically bounces off the coating. One of the first ones, and I did research with this company, was the OmniGuide system. And the OmniGuide system was one of the earliest waveguides. There are others out today. But this was taken specifically, it was an Israeli company that did the original formulation, and it took from the stealth technology for jets and put it into these waveguides. The problem with these system, it's a very, very good system, but it's very expensive. So the CO2 lasers themselves are far more expensive than diode lasers. And the waveguides are very expensive, and they are single use, and they are completely not able to be reused. You know, one of the advantages, well, there are a few advantages of the waveguide. One advantage is that you have handheld control, and you don't have to wear anything other than clear eye protection. Even the microscope itself is protecting you. It's not bouncing through the light of the microscope, the lenses of the microscope. But when you use this fiber, this energy is not going in a straight linear fashion like it does out of the micromanipulator. It is bouncing off of the waveguide in a curved fashion, and then when it exits the waveguide, because it doesn't dissipate, it's not absorbed by the silica very well, so it maintains its energy. However, because it's not completely straight, there is some dissipation of energy. And with that dissipation of energy from the angles that are made, there's heat. So these systems have been optimized to control the heat, but there is still heat. And so what happens is you get a loss of the input energy to the output, and you lose even more energy the more curvature you have. So you have to regulate your selection of energy, and you have to vary it a little bit. You have to start with a slightly lower energy and kind of work your way up till you get a good working energy, and realize that it's going to be affected by your positioning of the laser fiber and the angles. Not terribly, but it will to a bit. The other side effect of that phenomenon is that these fibers burn up. They actually heat up enough to stop working. So it is completely acceptable and common to be working with a fiber, and if you have a long use for it, for a specific kind of case, it may stop working. And the companies handle that fact by not charging you for more than one fiber. So this is a common practice. You have to make sure, if you have this kind of technology, that you have that kind of agreement. Stapedotomy fiber use, it's very brief. You're using it very little. So it's okay, you can get away with it. But if you're using it for, let's say, some kind of an ablative procedure, laryngeal or other, or oral cavity, those fibers are going to tend to burn up more. And you're going to be using them at higher levels. So what they did is they basically graded them with their perfectness of their tube. And if you have, and they have different ratings, so you have an S fiber for Stapes. It's a lower grade fiber actually, because they don't need it to work so long. Your neurofiber or your other general ENT fibers are actually better grade in the actual machining. So this is what's going on with these fibers, and they do burn. So when you're using them, you can all of a sudden you tend to smell something which is actually a burning of the internal coating, and it just stops working. And if you clog the very tip of it, it will also stop working. And you can refer, because we will have CO2 lasers, yes, and diode lasers. Yes, and what happens is, but we won't have probably handheld CO2. No, handheld diode, yes, of course. Now, so what happens when you're using these CO2 system, because it can easily burn from clogging, they blow air through it. So a small amount of nitrogen is actually being blown through. But this is very important to know, because when you make a stapedotomy, you have to turn off this air, because then you will blow a jet of air into the vestibule, and this will do physical damage. So you can actually do considerable damage by just bubbling air into the vestibule. So you can keep the airflow going throughout the cutting of superstructure and other structures, or if you have a very thick footplate, you have to be careful that you turn it off before you're about to penetrate into the vestibule. So these are the trade-offs. You have these excellent physics laser characteristics on the one hand, but you also have these other potential hazardous aspects. Now, so one of the, as I mentioned a few of these already, the non-CO2 systems can use a very cheap silica fiber. Okay, these can be produced for very, very little money and sold, of course, at a unreasonably increased price in most Western countries, but they're very, very cheap products. I mentioned this already about traveling through the air and this fact that they're single use. So we've covered most of this slide already. Now, one of the earliest fibers that I used was a KTP, and a KTP was green. So these are now in the visible spectrum, green. You know, KTP was also very good, and what it excites, it mostly excites the hemoglobin particles. So these lasers in this visible range, in this being in the green, has very nice tissue effect on vascularized tissues, and we used it in stapedotomy as well, and it can have a very, very nice low penetration so long as it's used carefully, because it will penetrate through the water, right? So in the visible range, these range, they go through the water. So when you get to the footplate, you have to kind of back off your aggressiveness and just try to avoid re-hitting. So you cannot do double hits on an open hole. Back to the CO2 laser for a second. We published a study. If you go to my website throughout my CV and list, you will see a published study on the safety of the CO2 in an animal model. We hit the same open cochleostomy we used, and we just hit it repeatedly over 10 times without any effects on cochlear nerve action potentials or any effects on the hearing on animals. So it's extremely safe. But in these, you have this additional risk about the fact that it's not absorbed by water. And KTP was quite nice and quite popular. For many years, we used KTP. Today, we have diode lasers. So one of the early diode lasers that came out, this was 1470, and this is used, they basically came out about 2000, and they're used largely for dermatological applications. And then around 2000, also this 980 frequency was used for general applications, including ENT. About 2010, we saw the introduction of 445, which is blue laser. Okay, it has to do with the frequency, it has to do with the color. KTP is 532, it's in the green. Okay, so now this is going a little lower in the frequency, and it's going to the blue color spectrum. So blue laser has some advantage over the 980, and I'll get to that in a second, but the major advantage of these diode lasers is that they're very inexpensive in comparison to all these other systems. And they can be used with a handheld silica-based cheap fiber. And cheap fibers can be reused because the effects on the fiber itself are negligible. All you have to do is trim the very tip of it and have a nice new clean end, and you lose 2-3 millimeters from a conventional fiber optic stripper tool and re-sterilize it, and this is what's done. Of course, in most Western or EU countries, you have systems where the number of times that the fiber is used is clocked in a chip that is connected to the attachment hub, and it shuts you off after 10 uses, and you have to buy a new fiber, even though the fiber is completely usable. So it's completely a commercial factor to basically promote, to maintain the consumables market. But there's no reason that you cannot use these fibers. And whether or not you can bypass this is, you would have to probably work out some kind of electronic system. It probably could be, but I haven't gotten to that yet. Now, there are lasers manufactured, and probably all of these lasers are manufactured in the same eastern part of the planet that don't have this, cutting you off at 10. So you get a 3-meter fiber, and you can just calculate. You lose a few millimeters every time you use it, and you can probably use this for months to years, depending on your frequency of use, before you have to purchase a new fiber. You just have to avoid breaking it, that's all. So you have to be careful with it. It's a thin fiber optic cable. Now, as far as the benefits of 445 or blue laser is, comparing to the other, it is better absorbed in the hemoglobin, and it also has better absorption within collagen matrices. Now, in the bone of the Stapes footplate, we do have, even though we seem to think of it as a avascular, a very thin piece, there are still some microvasculature, and there is a collagen structure and little micromarrow components. So what this does is this superior, you can see that it's better absorbed here than in the KTP or in the other, our other competing lasers, and especially comparing to this 980. So it's superior in that aspect. And what that does is about 30 to 40 times better absorbed in a hemoglobin. So it limits its rate of penetration. So it's a little less complete as it goes right through the footplates. And that's what you want. You want a controlled burn. So it is superior in that aspect. And there's also some benefits in its heat spread pattern. So the 445 is the newest laser and has some advantages over the 980. Many of you who have diodes who purchased them, a number of years back, like I think we have in children's, is a 980 system. They're okay. These are theoretical slight differences. Used properly, they're perfectly okay. But this is the reason why 445 or blue laser is now, you'll see marketing, you'll see blue laser. It's also used in vocal cord surgery, blue laser. There are very nice techniques developed for doing office laser procedures, passing the very thin fiber through a port in awake patients, and to vaporize lesions on the vocal cords, which have some blood vessels. So it's a very effective laser, nice and very inexpensive. I think we covered most of these safety concerns already. And yes, we did. And we'll talk a little bit about the laser. So about the power settings. It's not so complicated. I mean, you can look at this table and look at it in detail, but basically, start low when you're getting on the footplate, and it's about double. I start at around 4 watts when I use a 445 to cut some of the other structures, just to get a little more efficient burn. And then when you go down to the footplate, there's nothing wrong with starting at 1 and then going to 1.5 and then going to 2. And it just happens to be very similar to the same power settings that you use on a CO2 laser. So you just have to remember, 1 or 2 for the low end and start around 4. When you start using things like 6 watts, 8 watts, 10 watts, those are for soft tissue ablations of larger quantities. But this, 1 or 2 at the footplate, okay? And then you'll be safe. Now, in terms of surgical technique, there are a few ways to do it. So one way that we use is to make a rosette. And the reason for making a rosette, and you can do this with any of the systems, but when we use the CO2 laser, I was a lot more likely to make a complete rosette. And the rosette implies that you're going to non-overlap your fields, okay? So for any of the lasers, even the ones that penetrate water, you don't want to overlap. So you want to make a nice rosette of about 5, 6, kind of all next to each other. So you've created a bit of a thinning just so that it's just ready to crumble. And then once you have this rosette, you can take a very nice little straight needle or your little drill tool, hand drill, and just crack it so that it crumbles in and you have a nice opening to place for a small fenestra technique. The other is, you can see here, to make just a control hole to use prior to using a drill tool, okay? So if you make a control hole, you see this one didn't go completely through, so I turned up the power a little bit. This one went completely through. So once you have it completely through, you have released some of the vibrational energy and some of the internal physics by having the open hole. And you can proceed to doing a either drill technique with a very, very small micro drill, and it's a very safe technique as well. Or another technique is to do, if you're doing a partial stapedotomy for posterior, usually you take the posterior half out, you can make a linear crack across the center. Again, keeping in mind that you're just not overlapping, you're just not shooting this completely through into the vestibule. And by achieving a linear crack with a laser, then you can go on to crack that and remove the more mobile posterior part of the footplate. So these are the techniques that you keep in mind when using a laser. And we'll go over some of those things today. Okay, thank you very much. Thanks. Any questions? Okay. Thank you. Dziękuję bardzo.